Hi, my name is Alexa Henderson, and today I'm here to talk to you about a reproductive disease in dogs called Pyometra. Pyometra is a secondary infection that occurs as a result of hormonal changes in the female's reproductive tract. It is important to learn about diseases such as Pyometra for a few reasons. If you're going to be a veterinarian, an education about Pyometra will help you understand the disease in order to recognize it in its early stages in patients and have time to perform a necessary surgery. If you plan on breeding dogs, it is always helpful to understand the patterns in your dog's cycle and be aware of the diseases your dog could have and how they manifest. So what exactly is pyometra? As I said before, pyometra is a secondary infection that happens when there are hormonal changes in a female's reproductive tract. It is most common as a result of changes after estrus. When a dog finishes heat, progesterone remains elevated for up to 2 months. This happens so that the lining of the uterine wall can become thicker in order to prepare for pregnancy. Most dogs come into heat twice per year, although sometimes smaller dogs can have 3 cycles per year and giant dogs can have 1. So if pregnancy does not occur, the uterine wall will continue to increase in thickness until cysts form in the uterine tissues. This is called cystic endometrial hyperplasia. This can create fluids that are a good environment for bacterial growth. Why doesn't the dog's body fight off bacteria, you ask? It's because the uterine wall is already so thick that it can't contract in the way that it will expel the bacteria and fluids that have congregated there. Let's talk about the beginning of the disease, when dogs are in estrus. As you may know, the cervix is the gateway to the uterus, and it is what normally keeps bacteria and infections out. The dog is also protected by white blood cells, which can destroy harmful bacteria and viruses as they try to enter the cervix. But during estrus, white blood cells are not permitted into the uterus through the cervix, so that they don't kill the sperm, which are considered foreign substances. So with a combination of a relaxed cervix, lack of white blood cells, and a thickened uterine wall, bacteria are able to sneak by and grow inside the uterus. That's the natural way that pyometra often starts. Another way is through drugs, including progesterone-based drugs used for temporary or prolonged delay of the estrus cycle. A few reasons that a dog owner might want to delay estrus so that they can sync cycles with other dogs if the person is a breeder, or reduce fertility in the dog. According to the Merck Veterinary Manual, a dog is administered estrogen or synthetic estrogen drugs by the owner at certain times before a dog's cycle. It is supposed to start in the first 3 days of proestrus or bleeding. The drugs shouldn't be used for longer than 24 months, since there can be harmful effects. Estrogen or synthetic estrogen drugs can increase the effects of progesterone in the uterus. These manipulations are related to pyometra because progesterone has an immediate effect on the uterine wall. So if a female is intact and receiving hormones, she must be carefully monitored to see if pyometra is occurring. It is recommended that an owner spay the dog at a young age to prevent pregnancy in general, instead of trying to manipulate heat cycles in ways that could have harmful effects. Pyometra can occur in any sexually intact young to middle-aged dog, but it is definitely most common in older dogs, since they have had many heat cycles. It is uncommon that an older dog would go its whole life without getting pregnant if unspayed, but if it does occur, it is normally 2 to 8 weeks after the last estrus. So if you have an unspayed dog, how would you be able to tell if your dog has pyometra? If the cervix remains open, you will be able to see pus draining from the uterus through the vagina to the outside. It is often seen on the skin or hair under the tail, or on bedding or furniture where your dog has laid. Other signs of pyometra could include fever, lethargy, anorexia, and depression. These signs are not necessary for your dog to have pyometra, though. It may not show these specific signs. Instead of having an open cervix and seeing signs of pus, the dog could have its cervix closed. If this is the case, pus will not be able to drain to the outside, causing the abdomen to distend and feel hard. The bacteria will release toxins that are absorbed in the bloodstream. The dog will become very ill very rapidly because of this. They are anorexic, listless, and depressed. You may see vomiting and diarrhea in your dog. Your dog might also have increased urine output, as the bacteria can affect the kidney's ability to retain fluid, so she will increase water intake to make up for the loss in urine. This water consumption can occur in closed and open cervix pyometra. Let's say you see these signs in your dog. What would your next step be? If you see only vaginal discharge, you might have caught it in time so that your dog might not experience any further painful symptoms. Your next step would be to take your dog to the vet. The veterinarian would have a few options to test for pyometra: a severe elevation of white blood cell count in the body, a low concentration of urine on a specific gravity test. An ultrasound examination may be helpful in identifying an enlarged uterus and differentiating that from a normal pregnancy. Ultrasound changes that indicate pyometra include increased uterine size, thickened uterine walls, and fluid accumulation within the uterus. After diagnosis, your dog would need to be treated. The preferred treatment is to surgically remove the infected uterus and ovaries by performing an ovariohysterectomy, or a spay. Dogs diagnosed in the early stage of the disease are very good surgical candidates. The surgery is somewhat more complicated than a routine spay at this stage. However, most dogs are diagnosed with pyometra when they are quite ill, resulting in a more complicated surgical procedure and a longer period of hospitalization. Intravenous fluids are required to stabilize the dog before and after surgery. Antibiotics are usually given for 2 weeks after the surgery. Some people may ask, can my dog be cured of pyometra in a way other than spay? She's a valued breeding dog. Yes, there is a medical approach to treating pyometra. It is not normally recommended because the success rate is variable, and there is considerable risk and potential long-term complications. It can be treated with prostaglandins, or hormones, that lower the level of progesterone in the blood, relax and open the cervix, and cause the uterus to contract. Ideally, this would then raise an expulsion of bacteria and pus. Here are some limitations to the usage of prostaglandins. According to an article by VCA Hospitals, prostaglandins cause side effects including restlessness, panting, vomiting, defecation, salivation, and abdominal pain. The side effects occur within minutes after the administration and can last for a few hours. They become progressively milder with each successful treatment. The pain may be decreased by walking or exercising the dog for about 30 minutes following an injection. There is no clinical improvement for about 48 hours, so dogs that are severely ill and need immediate life-saving treatment are poor candidates. Because prostaglandins cause the uterus to contract, it is possible for the uterus to rupture and spill infection into the abdominal cavity, resulting in the severely life-threatening condition known as peritonitis. This is most likely to happen when the cervix is closed. The use of prostaglandins to treat pyometra has variable rates of success, recurrence of the disease, and successful breeding in the future. If pyometra is not treated, the toxic effects of the bacteria in the bloodstream can be fatal. A spay is the recommended treatment, with prostaglandins as a second but less effective treatment. So that was a lot of information. Let me condense it into a short summary. Pyometra in female dogs is a reproductive disease that is caused by the uterine wall becoming too thick as a result of multiple pregnancies not happening. Because the wall is so thick, it is unable to contract to expel bacteria. Normally the uterus is free from bacteria with the help of the cervix and white blood cells. But the cervix is relaxed during estrus and white blood cells are not present, as they try to not kill sperm during that time. If the uterine wall is too thick and can't expel bacteria, the bacteria can grow to form cysts and pus. It is a treatable disease, with spay being the main treatment option. Administrations of prostaglandins can also cause the wall to shrink in size. Overall, a veterinarian would recommend spaying your dog before it has the chance to contract this disease. But if you are trying to breed your dog, watch for the symptoms I mentioned in this video and consult with your veterinarian accordingly. Here are some of the sources that I used in this project. The first one was an article called Pyometra in Small Animals, Reproductive System by Merck Veterinary Annual. The second one was from VCA Hospitals called Pyometra in Dogs. The third source I used was an article called World Small Animal Veterinary Association World Congress Proceedings, 2006. The final source I used was called Hormonal Control of Estrus in Dogs, Management and Nutrition, also by Merck Veterinary Manual.